You are suspecting that you have got COVID. What should you do? First of all, do not panic. In today's video, I am going to tell you the exact steps that you should be doing once you suspect that you have got COVID. Consider this to be a personal action plan which you can use if you get the disease or somebody close to you, a family member or a friend gets the disease. A little bit first on how this coronavirus affects your body. I will try to keep this as simple as possible. COVID attacks your lungs very aggressively. But the defense mechanism of your body is not dumb. It has got its soldiers which will fight the war. So essentially, your lungs become a battlefield wherein the immunological cells of your body are fighting against the coronavirus. This is going to be a bitter battle. And what happens to the battlefield? When there is a large battle, the battlefield becomes totally ravaged and becomes full of debris and waste. And it is this waste which is the inflammation which is causing you the pneumonia. The coronavirus disappears from your body from between 7 to 9 days of your disease. But your pneumonia persists and worsens because of the formation of thrombi in your lungs. And this is when the need for oxygen arises. You would like to, through this action plan, at all costs, avoid getting to the stage where you require oxygen. If you get COVID, 80% of the people are going to be either asymptomatic or very mildly symptomatic. 20% might require more rigorous help. And unfortunately, from this 20%, 2% of these people might not make it. You would at all costs like to keep yourself at the 80% of the mildly symptomatic patients. As of today, there are very effective and good treatment norms laid down for the management of the COVID-19 virus. However, it requires you to work immediately from day one. In today's video, I'm going to give you point by point what you should be doing once you suspect you got the COVID-19 virus. At the onset of the first symptoms, it could be as minor as a runny nose, an itchy throat, or a slight fever. Just assume that you have got COVID. Do not think it is the flu. I will put a video here for your reference on the symptoms of COVID-19. There is no flu in the air today. There is only COVID. So the first thing you should be doing is self-isolation. Isolate yourself in the room and wear a face mask, and have the rest of your family members also wear a face mask so that you do not infect them. The biggest problem with the coronavirus is that it is very infective. In a hypothetical situation a few years ago, if you had a flu, you could be more or less sure that the rest of the families may not get infected. But with COVID-19, it is not so. It is very highly infectious, and if you have got COVID-19, it is highly likely that the rest of the family members will also get COVID-19. So remember, the first step should always be self-isolation. At the onset of the first symptom, I want you to do this test immediately. Your RT-PCR, CRP, CBC, D-dimer, and blood sugar. Your RT-PCR report might take 3, 4 or 5 days. It does not matter. We are not going to go on the basis of your RT-PCR report. We have to start your treatment from day 1. After this, we will be treating you symptomatically. The blood test will be giving a baseline for reference for your further treatment. We do not wait for your RT-PCR test because it could take 3, 4, 5 days, maybe even more. By that time, if your case is complicated, it might be too late. Besides the RT-PCR, the results of all the other tests will be ready on the same day. But only please note, please do not go walking into your pathological laboratory. Do give them a call so that they can take precautions so that you do not infect other people who are also present in the lab. Once you get all the blood test reports, barring the RT-PCR, immediately give a call to your doctor. Again, do not walk into his clinic. Give your family doctor a call and take his advice. He will be in a very good position to treat you, as the treatment protocols are very clear and very effective. If you do not have a family doctor yet, now is a very good time to pick up one. Listen to the advice of your doctor to the T, and you will be in a very good position to win over this illness without much harm done. The next step is to monitor the progress of your disease. You would like to check your body temperature 3 times a day, your oxygen saturation levels 3 times a day, 6-minute walk test twice a day, morning and evening, and also your blood sugar levels and high blood pressure if you have comorbid conditions. In the description box down below, I will leave a downloadable form for you to track the statistics of your illness. Download the page and keep one page for every day of your illness. Just to summarize the steps you should be taking to keep yourself from severe COVID: isolation, your blood tests and your RT-PCR, contact your family doctor and take his advice, and monitor the progress of your disease. I hope this video has provided you with some value. Do give it a like if it did. Do subscribe down below if you haven't already. I hope you stay safe. Signing out, Dr. Rohan Fonseca.